Calquence is indicated for the treatment of adult patients with mantle cell lymphoma who have received at least one prior therapy. Indicated for the treatment of adult patients with chronic lymphocytic leukemia or small lymphocytic lymphoma. Dosage and administration. Calquence as monotherapy. The recommended dose of Calquence is 100 mg taken orally approximately every 12 hours until disease progression or unacceptable toxicity. Calquence in combination with obinutuzumab. For patients with previously untreated chronic lymphocytic leukemia or small lymphocytic lymphoma, the recommended dose of Calquence is 100 mg taken orally approximately every 12 hours until disease progression or unacceptable toxicity. Start Calquence at cycle 1. Each cycle is 28 days. Start obinutuzumab at cycle 2 for a total of 6 cycles and refer to the obinutuzumab prescribing information for recommended dosing. Administer Calquence prior to obinutuzumab when given on the same day. Advise patients to swallow capsule whole with water. Advise patients not to open, break, or chew the capsule. Calquence may be taken with or without food. If a dose of Calquence is missed by more than 3 hours, it shall be skipped and the next dose shall be taken at its regular scheduled time. Extra capsules of Calquence shall not be taken to make up for a missed dose. Recommended dosage for hepatic impairment. Avoid administration of Calquence in patients with severe hepatic impairment. Dose modifications are not required for patients with mild or moderate hepatic impairment. Precautions. Serious and opportunistic infection. Fatal and serious infections, including opportunistic infections, have occurred in patients with hematologic malignancies treated with Calquence. Use of antithrombotic agents concomitantly with Calquence may further increase the risk of hemorrhage. Side effects. Serious and opportunistic infections, hemorrhage, cytopenias, second primary malignancies, atrial fibrillation and flutter.